In this video, we are going to walk through a calming 2-minute ritual that neutralizes acid and prepares your teeth to repair themselves while you enjoy deep, restorative sleep. As we drift into this evening's reflection, we will gently explore 3 key areas. First, why dryness is the silent enemy of the aging smile. Second, a simple rinse that balances your chemistry before bed. And finally, the exact routine that locks minerals into your enamel while you sleep. We are building a nightly habit that provides true peace of mind. Let's begin this journey toward quiet confidence in your smile. You deserve to rest without the nagging worry of future dental trouble. The truth is, most of the damage to your teeth doesn't happen during the day when you are eating. It happens slowly at night when your mouth's natural defenses are down. Acid attacks on your enamel weaken your teeth, making them vulnerable. If you stop the acid, you stop the wear. This simple understanding is the foundation of our entire routine. If you find this gentle, slow approach to health comforting, please consider subscribing. That gentle act helps us keep this quiet sanctuary going for all who need it most. Our first and perhaps most surprising step involves patience. Many of us were taught to rush to the sink immediately after a meal, scrubbing away the food particles. But if you have just finished dinner, or even a nighttime snack, your mouth is highly acidic. Foods and drinks, especially wine, fruit juice, or even some medications, lower the pH balance in your mouth. Your enamel, the hard shell of your tooth, becomes softened by this acid. Brushing immediately after eating is like scrubbing a wet sponge against a softened surface. You actually risk brushing away the enamel itself. So here is the essential rule to begin our ritual, the 30-minute waiting period. You must allow your mouth's natural defenses, the saliva, time to work. Saliva is a wonderful, natural buffer. It raises the pH level back to neutral, allowing your enamel to reharden slightly. Only once that enamel is firm again should you introduce the toothbrush. If you usually eat right before heading to bed, simply adjust your timing. Finish that last sip of water or last small bite at least a half hour before you start your preparation for sleep. This simple adjustment is the first key to preserving your smile. Now that we have waited, our first active step is the neutralizing rinse. Think of this as gently flushing away the last remnants of acid and soft debris before we get serious about cleaning. Take a large sip of plain water. Room temperature is often most soothing. Swish it slowly around your mouth, ensuring it reaches all the areas where food might linger. Do this gently for 20 seconds, and then swallow or spit it out. This water rinse is non-abrasive and incredibly effective at raising that pH level and preparing the surface of your teeth for the real cleaning. For those who enjoy a little extra buffering, adding a pinch of baking soda to a small glass of water can amplify this effect, but plain water is perfectly sufficient. The goal is preparation, not sterilization. We want the mouth ready for the minerals. Next, we address the sequencing of your tools. Most people reach immediately for the brush and paste, but the most important part of your mouth care, especially as we age, happens in the tiny spaces the brush cannot reach. We must start with flossing. Flossing removes plaque and debris caught between the teeth and under the gum line. If you skip this, you are simply pushing your toothpaste, the powerful repair mineral, onto a dirty surface. Floss first. Clear those channels. If you struggle with traditional string floss due to arthritis or reduced dexterity, please know there are wonderful, gentle alternatives. Water flossers are highly recommended for older adults. They use a fine stream of pulsating water to safely and soothingly massage the gums and clean the pockets. It is much gentler on receding gums and equally effective at clearing debris. If you use a water flosser, use lukewarm water and work slowly around each tooth. Remember, floss first, brush second. This sequence allows the mineral-rich toothpaste to access the newly cleaned surfaces effectively. Now we move to the brush itself. The brush should be soft, always. As we age, our gum tissue often recedes naturally, exposing softer root surfaces that are easily damaged. Using a medium or hard bristle brush is like taking sandpaper to your roots. Use a soft or even extra soft brush, applied with the lightest possible pressure. We are not scrubbing rust. We are gently polishing. Electric toothbrushes are an excellent choice for seniors, not because they clean harder, but because they enforce a perfect gentle pressure. They do the work for you. Many models even stop or flash a light if you press too hard. If you prefer a manual brush, hold it with just your fingertips, not a firm fist. This forces you to use less pressure. Spend 2 full minutes slowly gliding the brush over every surface, including the cheek side, the tongue side, and the chewing surfaces. Think about tracing the curve of the gum line, allowing the soft bristles to gently sweep away plaque. This is a moment of care, not of hurried chore. And now we arrive at the most vital component of the entire ritual, the secret that ensures your teeth are repairing themselves all night long. After you have completed your slow 2-minute brushing routine, do not rinse your mouth vigorously with water. This is the crucial step most people miss. Your toothpaste contains the active mineral ingredients, whether that is fluoride or the newer effective mineral called hydroxyapatite. These minerals are the building blocks that repair the microscopic damage done to your enamel during the day. When you rinse with water, you wash all of that protective mineral shield straight down the drain. You reduce the effectiveness of your care by up to 80%. Instead of rinsing, simply spit out the excess toothpaste foam. That is all. The thin layer of residual paste left on your teeth will stay there all night. It will slowly release those strengthening minerals into your enamel and the dentine below, actively repairing and fortifying the surface while you are sleeping peacefully. This is called the leave-on technique. It transforms your nighttime rest into a powerful dental treatment. Think of it this way. The minerals need time to sink in. If you were applying a soothing lotion to dry skin, you wouldn't immediately wash it off. You let it absorb. Treat your teeth the same way. Simply spit, don't rinse. This simple discipline is the true secret to stronger, more resilient teeth after the age of 60. Even if you follow the perfect ritual, one common factor can sabotage all your efforts: nighttime dryness. For many seniors, medication or changes in saliva production mean the mouth becomes excessively dry during sleep. This is medically significant because saliva is the primary carrier of those protective minerals and buffers. A dry mouth is highly acidic and is the single biggest risk factor for root decay in older adults. If you wake up with a parched mouth, consider some gentle countermeasures. First, look at your breathing. If you sleep with your mouth open, dryness is inevitable. Try positioning a pillow to encourage side or back sleeping, which often promotes nose breathing. A gentle pre-bed humidifier in your room can also introduce moisture into the air you breathe. Second, seek out specific mouth moisturizing products. These are typically gels or sprays designed to mimic the texture and protective qualities of saliva. Avoid any mouthwash that contains alcohol, as alcohol is highly drying and counterproductive to your goals. The goal is to keep that mineral coating we left on your teeth wet and active. Let's quickly address common adaptations. If you wear partials or dentures, remember they must be removed and properly cleaned. But your gums, tongue, and any remaining anchor teeth or implants still require the gentle application of this ritual. Clean those surfaces slowly with a soft brush and a tiny amount of mineral paste before placing your appliance in its overnight soak. The surrounding tissues are the foundation, and they need care. If you struggle with the timing, finding that 30-minute window before sleep, try adjusting your routine slightly earlier. Begin the process just before your final wind-down activity, such as listening to music or reading a book. By the time you climb into bed, the residual mineral protection is already in place, working quietly for you. Do not let scheduling prevent you from practicing this simple, powerful routine. This is not about perfection. It is about consistency. To summarize the ritual, you can begin tonight. 1. Wait 30 minutes after eating or drinking to allow your enamel to reharden. 2. Use a gentle water rinse to neutralize acidity. 3. Floss first, then brush slowly with a soft tool for 2 full minutes. And most critically, 4. Spit the excess paste, but do not rinse with water, allowing the minerals to work overnight. This ritual is not complicated, but it is deeply effective. By mastering this simple sequence, you take powerful control over your dental destiny. You stop the slow process of decay and allow your body to heal and strengthen itself while you are resting. This knowledge is your greatest preventative measure. If this guidance has brought you a feeling of calm and preparedness for the night ahead, please like this video. Subscribing ensures you never miss a moment of peace and gentle wisdom from our sanctuary. May your rest be deep, your worries few, and your smile remain strong and steady for all the years to come. Sleep well,